And you let me know when you want me to start sharing.
Will do. All right, welcome everyone to today's webinar. I am Susan Ryan. I'm the Senior Director for the Greenhouse Project, and I am delighted that our sponsor today, Select Rehab, has decided to share a wealth of wisdom, aka Dr. Kathleen Weisberg, to be able to talk about well-being and workforce. But let me first of all, thank Select Rehab for their incredible sponsorship. We are really proud and honored to have them. We wish we were at a conference this year and we'd be able to network with them and all of that, but really grateful that they agreed to share Dr. Weisberg. So let me read Dr. Weisberg's bio, then get out of the way and let you experience the wealth of wisdom. Dr. Kathleen Weisberg, in her over 25 years of practice, has worked in adult rehabilitation, primarily in long-term care, as a clinician, manager, researcher, and most recently as education director with Select Rehabilitation, where she oversees continued competency and education for approximately 6,000 full-time therapists. She is also a professor at Gannon University in Erie, Pennsylvania, and at Chatham University in Pittsburgh, Pennsylvania. She has authored publications on topics ranging from patient wellness and trauma-informed care to dementia management and coding billing compliance. That's an incredible wide array of skills, just saying. She has lectured internationally, nationally, and for various state associations on topics including elder bullying, adult sexuality, and the Montessori approach to dementia care. And I have to tell you, as Kathleen and I were talking before the broadcast started today, she's somebody who practices what she preaches, and she can share more about how she might do that. But I think as I did a preview of her PowerPoint that she will share with you today, I'm excited for the things that she will talk about, some of the strategies and suggestions that she has for all of us to really maintain well-being. One last thing before I turn it over to Kathleen is to make sure that you take advantage of the chat box to introduce yourself. We love building a virtual community. So introduce yourself, the organization in which you come from, as well as if you've got any technical difficulties, you can put them in the chat box. If, on the other hand, you have a question for Kathleen, at any time during the presentation, feel free to put your question in the Q&A box. And Kathleen has agreed graciously to monitor the Q&A box through her presentation, and she will take your questions as they come. So Kathleen, with that, I am so glad you're back and looking forward to your presentation today. Thanks so much, and thanks to Select Rehab.
Thank you for that introduction, and I will go ahead and share my screen. There we go. And hopefully everyone can see my screen. Thank you so much for joining in today. And yeah, I do. I practice what I preach. I will tell you, since we have started, since back in January and even through, I have really focused on my own health and well-being during this health crisis. I found it an opportunity to, and for anybody who knows me, or if you don't know me, I would be a workaholic. I would work 24/7 if I could. I would always be in my office, always doing something. And I've stepped back and said, you know, I got to put my priorities in line. And you'll hear me say it a couple different times. We say in healthcare, the other 23 or the other 23 and a half, I don't care which one. You have 23 hours to do whatever else you want to do in your day. Let's take 1 hour just for me, just to do something. So my family and I we've all been doing that throughout this pandemic, and it's certainly paid dividends. So anyway, with that, let me just give a quick introduction. I think for all of us, this pandemic has created new and unique challenges. We have uncharted waters, making it important for all of us to find ways to interact with each other, ways to take care of our own mental health, our own physical health, our well-being, to deal with any stress that we're having, any depression, those sorts of things. And if you think about it, a lot of us are teleworking probably for the first time. Maybe we're just now getting back into our offices. Many of us have been isolated from coworkers, from friends, from family. I was sharing before we got started, I just saw my family this past weekend, who they live in Pittsburgh, I live in Delaware. And I just saw them for the first time since Christmas. So it's really tough. And our daily routines have been disrupted. And what does that create? It's anxiety and it's stress and it's strain mentally, physically, financially. And if you think about it, now more than ever, it's going to be completely natural for that disruption and uncertainty to lead to anxiety and stress. So that's what we're really here to talk about. And now more than ever, we really do have to take care of ourselves. So with that in mind, the objectives for the session today are listed on this slide. We are going to explore some strategies that employees can enact to address their own health and wellness during an infectious disease outbreak. And I use that general term because I don't think this is just COVID related. Think about it, you know, how many of us work in places where, you know, the flu comes and we're quarantined, or we have to shut down, or we have to limit visitors or something. So this isn't just COVID related. These are things that we can do all of the time. We're going to provide you some example exercises and some activities that you can use for your own health and wellness, things that you can do on the job. And I will hopefully demonstrate some of those for you. And certainly identify some staff responses to mitigate the transfer of stress from caregiver to resident, because if we're feeling it, assuredly they will feel it as well. So I thought what we would start off with is just talking a little bit about quarantine. What can you expect during this period? What can you expect during quarantine? And of course, everybody reacts differently to stressful situations like infectious disease outbreak. That is requiring, I mean, think about it, we're all going through social distancing, quarantine, isolation. You're going to feel, and it's very normal to feel, anxiety, worry, fear. Maybe that's related to your own health status. Maybe that's related to the health status of people you may have exposed to the disease. I live across the street from a person who owns a daycare center, and she has said repeatedly, you know, I'm not so concerned about me, but what am I bringing home from either, you know, parents or kids or somebody that I've interacted with, and now I'm giving it to my family. Maybe there's resentment from friends or family or people that you've contacted because maybe they have to go into quarantine because they've been exposed or had contact with you. Maybe it's that experience, you know, just monitoring yourself or being monitored. I mean, how fun is it to take your temperature every day? I was sharing again before we started, I'm a part of a scouting family, and while we're not going to camp this year for other events that we have to do or we're engaged in, our kids and our entire family have to do a quarantine health survey every single day for 14 days prior to going to that. So it's not just going to work, it's everyday normal activities that we're being monitored, you know. Maybe you've had to take time off of work, and related to that, there's the loss of income, your loss of job security. Is that job going to be there again? I don't know. And just challenges maybe about securing things that you need, your groceries, your personal care items, things that you might need in your household. Maybe it's a concern about being able to care for others. You know, it's your children, or maybe you have your parents who live with you or other individuals. Thankfully, we're finally done with school, but we were homeschooling for a while, and that was a big concern. Maybe it's uncertainty about, you know, how long are you going to need to remain in this situation? How much longer is quarantine going to last? How much longer are the restrictions going to last? Maybe it's loneliness. Maybe it's anger. That's an interesting one. Maybe because you were exposed to the disease because somebody else was negligent and you're angry with them, and you might feel that. Maybe there's, we already said boredom, frustration. Maybe there's a desire to use or overuse drugs, alcohol, food. I mean, how many of us have heard, you know, people who are overeating and now summer's here and it's swimsuit season and they're not quite ready. Or symptoms of depression. post-traumatic stress types of syndrome. And again, it's out of the scope of this, but trauma-informed care principles would apply here. So, and as we go through that list, probably some of you are thinking, yep, checking off the boxes, that applies to me. And when you're in quarantine, and so there are stressors related to that too, your self-isolation. So we are separating individuals who maybe have been exposed to that infectious disease. And think about the toll that it's taking on your residents. Think about the toll that it's taking on you to be a part of that every single day. And, you know, when we look at the quarantine efforts, they've ranged from mass quarantine in large cities, for example, in China and other countries, to isolation, maybe in government-run type facilities, to just self-isolation at home. And while quarantine, if you think about it, serves the public good, at least in a broad sense, there are also psychological challenges related to that, to us, for our loved ones, and particularly for healthcare workers. So some of the stressors, again, that you might be feeling, similar to what we talked about on the other slide, frustration and boredom, again, related to that isolation, loss of your usual routine, you know, your regular home activities, work activities, shopping for necessities, and even as things are starting to reopen, it's not the same. It's very, very different. So there's that change in routine. Limited physical contact, social contact with others. And again, we're starting to open up, we're starting to see each other, but it's still not the same. Maybe it's an inadequate supply, so medical care, food, water, even just a change of clothes, masks, getting your prescriptions, getting thermometers. That's been a real challenge during this. Insufficient information. I mean, sometimes it's too much information, sometimes it's too little information. And oftentimes when you look at what we're getting, there's poor coordination. And I'm not saying, I'm not going to give an opinion on that one way or the other, because I don't have one, but it sounds like sometimes one party saying one thing, one entity saying something else. And a lot of times, whatever we are hearing, it's very negative, and we're not always hearing some of the positive. The longer durations of quarantine, again, it continues to be extended. Again, I will tell you, I live in Delaware, and our state of emergency, if you will, has been extended over and over again. How much longer? You just don't know. And that raises some stress for some of us. And then, of course, there's those fears about either becoming infected, infecting others, which again can be manifested as, you know, more worry about your own health, about your physical symptoms, and obviously very concerning for certain populations, you know, people who are pregnant, individuals who have elderly folks living with them, maybe people who have a weakened immune system to begin with. Other stressors, and I think a big one of these is financial loss. Let's think about it. So if you've been absent from work because you've had the virus or something, you've had healthcare costs. I'm sure you're seeing all the stories coming out of people who've been treated and now their healthcare bills are coming in. Other anticipated financial burdens. Maybe you've lost your job through all of this. Maybe it's a complete layoff. Even if it's only a furlough. I mean, we're hearing, you know, that those benefits from unemployment are not coming in as quickly as some might need. So there's that financial loss. Certainly stigma, stigmatization, rejection by neighbors, by friends, by coworkers, treated differently with fear or even suspicion. You work in the healthcare sector and now here you are at somebody's, you know, Memorial Day barbecue. Can I go near them? Should I not go near them? You definitely see that. And that stigma can definitely be exacerbated if those quarantined individuals are members of a particular ethnic or racial group. And we're seeing that, or even a religious group. And then, of course, there's getting back to the normal routine. As I said, we're obviously starting to open up a little bit, but that getting back to normal, that could be a couple of days for some of us. That could be weeks, that could be months, who knows? I think a lot of us think to a degree that the switch is just going to be flipped and we'll go back to normal. But I think a lot of that really depends on how much you've been disrupted by this quarantine, by what's going on. I work from home, so my routine hasn't changed a whole lot. But other people who are used to going into a place of employment or traveling or doing certain things, certainly that is very, very different. So how can we focus on well-being during quarantine? I think one of the biggest things that we can do is using communication as an intervention. When we talk about communication, that's not just to our residents about what's happening and the why behind our decisions, but that's also to our staff. That's also to our families. I think we need to be very open and honest with our families. When you come home from work, what have you been exposed to? What might you be exposing them to? And the more that communication is very clear and concise, culturally appropriate, the better off that we are. And that again goes, hand in hand with facilitating communication with our loved ones. And a lot of our stress, and maybe even a lot of our resident stress, is coming from, are my loved ones okay? Are they sick? Are they, how are they weathering all of this? And when you don't have that contact necessarily, you don't know. And not knowing really increases your anxiety and your stress. Preparing for quarantine equally is important. So obviously we're in the throes of this. So are we preparing per se right now? Not necessarily, but let's think about the fact that there could be a second wave or some other wave. And even now today, we can still be thinking about what is available in my community? What precautions do I need to take to access those things in my community? Maybe, there's still, special hours for grocery shopping or certain things like that. So you can certainly continue to prepare. Reducing boredom and isolation, we'll talk a little bit more about this, but as much as possible, we need to engage in activities that are meaningful, that are fun, that we want to do, and they're going to keep our mind sharp and keep us cognitively, mentally awake and aware. And whatever that is, I don't know. It's going to be whatever works for you. And certainly taking care of yourself. We're going to talk about that ad nauseum today for sure. So a couple other things that I think are important. First of all, understanding the risk. When we look at what we're going through, you need to consider the real risk of harm to yourself and others. And the public perception sometimes of risk is that it's inaccurate, the public perception. And media coverage sometimes creates this impression that people are in immediate danger and risk, when maybe in fact the risk is a little bit lower than that. So you need to take the steps to get the facts and get accurate information. And I don't know where that comes from. That's up to you and what's meaningful to you. But you need to stay up to date with what's happening while you're also limiting your exposure. Again, if you're on media 24/7, what the research is already initially starting to show is that is triggering anxiety, stress, increased panic, increased worry. And so you need to use your trusted media outlets, get the information that you need, and then shut it off and walk away, and then come back as well. And understand too that our seniors are going to be impacted a little bit differently by the media, and our children as well. There's just a different thought process there. They're affected very differently by what they hear and what they see. And I think too, this is just me. I am really trying to seek out some of those positive stories, not just the negative. And if I just go to the media, oftentimes that's all I hear. And I'm trying to find, who beat the virus at 103 years of age, and who's going home, and who was able. I just saw something the other day, and I don't even remember what nursing facility it was out of, but a man and a woman who hadn't seen each other, married for 50 plus years, had finally been able to see each other. And the photos were just heartwarming, holding hands and just sitting next to each other and sharing stories. We have to do that. We have to look for that positive, because that's going to help all of us in the long run. Other things we need to make sure that we're doing, creating and maintaining a routine. And this is hard. So part of that routine is related to health and wellness. It's super easy when you're home or what have you to just sit on the couch an awful lot. I heard an advertisement the other day. I don't remember what company it was even for. It said, when was the last time you wore a belt? And I got a kick out of that. We need to maintain a health and wellness routine, but a routine in general, a regular schedule. So if you're working from home, setting up a designated space to do that. Homeschooling obviously is over, but maybe there's a space for your kids to try and stay on their routine. even if you're still working at your center, you need to establish some sort of routines, because those routines are what's going to help you to, I say, stay sane, but help you to cope. And building in time in that routine to get movement, to get some exercise, to just get up and do something, even just once an hour or even every 2 hours, get up and move around and do something for you. We'll talk about that in just a few minutes. So let's talk about stress management. Dealing with stress, think about it. We are all healthcare professionals here. We have a service orientation. We lack time, let's be honest. We oftentimes have difficulty acknowledging or recognizing our own needs. And we talked about this before we got started. It's that self-awareness that I have stress, I have signs or symptoms of depression, I'm not dealing with this so well. And we have to be honest with ourselves when we have some of those issues. And two, there's this stigma and this fear that if I as an employee speak up and say, oh yes, I'm feeling depression, I'm feeling all this stress, that I'm not either A, going to get the support that I need, or B, my employer may say, okay, well, maybe you should take time off. Maybe we should furlough you instead of someone else. So a lot of times people don't speak up. And the reality is we prioritize everyone else's needs above our own. That's what we do as healthcare providers. We got to step back and stop doing that. We got to put ourselves sometimes first. So what can you do? You can obviously read the slide. Self-monitoring, pacing, checking in with your colleagues, your family, or friends. Some brief time out. And, if you're working in a center, again, 5 minutes to say, look, I got to go take 5 minutes to decompress. I just had to do X, Y, and Z. I just need 5 minutes alone. I can't think of an employer who's going to say, no, you absolutely can't have that, as long as obviously it's within reason. We need to keep our anxieties conscribed to actual threats, not our perceived threats, and certainly focus on what's within our power, accepting what you can't change. I mean, I watch this with my parents. They stress and worry over everything. And so much of it is things that they have absolutely no control over, yet they stress and worry about it. So some of the things that, again, we can implement with ourselves, with our colleagues, make sure that we're not working too long by ourselves without checking in, or working around the clock, not taking breaks. I mean, you hear people talk and say, oh, it would be selfish of me to take a rest when everybody else is working. Everyone else is working around the clock. I need to be doing the same. Or, everybody else is doing X, Y, and Z. I'm just not doing enough. We can't do those kinds of things. Stay away from the sweets, stay away from the caffeine. They help you in the short term, but they don't help you in the long term. And certainly get over those obstacles. I can contribute the most if I'm here 24/7, and we hear our management team say that all the time, don't they? Or only I can do X, Y, and Z. Now is the time to give up that power and really rally your team around you, because if we don't, we won't succeed. Some other things that we can do: be prepared. Again, particularly now, coming up with your family, your personal preparedness plan, maybe not for our current outbreak or our current situation, but thinking about if we have another wave of outbreak later on this fall. Taking those everyday preventative measures. We should have been doing this anyway: hand washing and hand sanitizer, and keeping your distance from folks and using your PPE. Maintaining a healthy diet and exercise, we'll talk about that in a second. Certainly talking to loved ones about your worries, about your concerns, and having them talk to you, because that sharing sometimes helps in healing. It's very cathartic. And engaging in hobbies and in activities that you enjoy. And I saw something on social media, I don't know what they posted, something about my only hobbies apparently are eating out and shopping and what have you. And they said, I need to find something else to do with my time now that I'm home. And that's just it. You need to find something that is meaningful and engaging for you. So I do have a question in queue. So let me read that very quickly. And the person chimes in a community that I work with, the elders started to understand the reason for this compassionate confinement at first, yet after 4 months, it's getting more challenging. The assisted living residents miss their friends in independent living. The team there has implemented outdoor visits with family. The elders are getting weary of the isolation and are ready to bust out. Thank you for sharing. I think that's how we all feel right now. And I think what you just hit on is that creativity that we need to figure out, whether it's us with our loved ones and our friends and getting out, or helping our residents to do the same. We got to get creative and figure out how we can do that and still keep them safe. So thank you very much for sharing that, because I think we all kind of feel that way. I'm ready to bust out myself. Sorry, let me get back into the PowerPoint here. There we go. So other things just to keep in mind. Using some practical strategies, and now we're going to start getting into some actual things that you can do. Relaxing. Find something that works for you. I don't know what it is. I know what's relaxing for me. I take a hike every single morning, unless it's raining, of course, and I'm out on the trail for a good 5 or 6 miles, and I can start off my day and I feel fabulous. You figure out what works for you. Pace yourself during stressful activities and between those. You know, if you're jumping from resident to resident and then having to deal with communication, with families, with other things, you know what's going to be stressful for you. Take a pause in between and take a breather. And again, figure out what that is for you. And maintain that sense of hope. We're going to talk about hope in a little bit, but it's very important, again, to try to find that silver lining, to try to find the positives. So let's talk about some stress relievers that you can do at work. And the first one is something called progressive muscle relaxation. And I don't know about the rest of you, but when I am stressed out, I feel it here. I feel it in my shoulders, and you feel the weight of your world on your shoulders. Progressive muscle relaxation is starting with your toes, working the whole way up, tightening up those muscles, and then releasing them. And as you do that, what happens is you start to really feel where that stress and where that tension is. And the more you practice that, the more you just let it go. And you probably feel it mostly in your shoulders, but you probably feel it other places too. An easy thing that all of us can do is visualization. So maybe you can't go to your happy place. Maybe your vacation was canceled this year. We're hearing a lot of that. But maybe you visualize it, or visualize something that's going to bring you some sort of comfort. And I think that goes hand in hand with engaging your senses. So not just thinking about it, but trying to feel it. What would you smell there? What would you experience there? And maybe that's something you do even in your own community or at home. Since we've been home, I've been doing a lot of baking bread, baking cookies, you name it. We have all sorts of stuff going on in the house. And that smell is really relaxing. I mean, how can you not smell chocolate chip cookies in the oven and think about home and think about relaxation? Or maybe it's something that you see, or maybe it's something that you taste or touch, but engage your senses. Deep breathing is another one that is really great. So again, take a deep breath, hold it, do a count, whatever works for you. But what you do when you do that is, again, you start to feel your muscles and you start to get that relaxation. And certainly laugh at yourself. There's a reason they say that laughter is the best medicine. Again, try to find those humorous things. Some other, again, simple things. And I'm not going to read all of these, but start your day off right. There's a reason they say that breakfast is the most important day. So start your day off, get organized, because things are going to be thrown at you. And so if you at least start off trying to be organized, if something does get thrown at you, maybe you can handle it a little bit easier. Walking at lunch, or doing some exercise, or even stepping aside and reading a book at lunch, or listen to some music. Again, you're going to figure out what works for you, but I continue to say, find what works for you and do it. Fresh air is one of the big things. Everybody's been talking about, as much as we can get out, and now it's wonderful that we have some great weather, particularly in the Northeast and some other places that get out and certainly enjoy that. Okay, so some other simple things that you can do at work. And so I'm sitting in my chair, and I'm not going to stand because I don't want to change my camera up. But some very simple yoga poses. So hopefully you'll sit there and do these along with me. This first one on the left-hand side of the slide is a seated crescent moon pose. So you're just going to very, very tall, reach up overhead, and then lift your arms, stretch your fingers wide, lean to the right, lean to the left. Do a couple deep breaths while you're there. Come back to the neck, come back to middle, and then go to the other side. So just really simple stretches that you can do seated in an office chair or seated around the table. The next one is a seated back bend. So I'm going to turn for this one. So what you're doing here is you're putting your hands behind you, and you are truly just looking up and stretching it all out. So you're going to have a nice straight spine, deep breath, reach all the way behind you, and then look up to the ceiling. Exhale, and slowly but surely try to look as far behind you, bending slightly your upper back, your upper chest, and then you hold it. And if you're doing this right now, I hope you think that it feels pretty good, because it does. It stretches you out quite a bit. We tend to have some really bad posture if we sit too long. Next one, pretty simple. This is just some hand stretches. So stretch out your fingers. Stretch out your hands, jazz hands, do whatever you need to do, your wrists, what have you. Particularly if you're working at a desk a long time, that consistent typing or what have you can certainly be painful. The one on the right-hand side of the slide is a seated twist. So really easy, you're just going to sit in your chair, inhale, and then on the exhale, you're going to twist to one side and look over your shoulder as you do that. Sit there, and you can grab the back of your chair, you can grab the armrest. My chair happens to have armrests, and then you're going to switch to the other side. And again, looking the whole way over. And if you're doing this, you should hopefully feel it in your upper back, and you should feel that stretch. Next one I'm going to tell you is probably one of my favorites. This is the chair pigeon pose. So while you're seated in a chair, you have both feet flat on the floor, cross one leg over the next. And then as you do that, you're going to turn to that side. So you turn your whole body. You want to keep your foot, in this case, flexed, so you're not placing any pressure on your knee. And then again, maintain equal weight bearing on your back side. And then you should just feel a nice stretch on the outermost part of your thigh, and you should feel it a little bit in your trunk as well. So again, you start to get some of that relaxation. And then I'll obviously switch to the other side. The one on the right is a sit and stand chair pose. So I'm going to back up and see if I can do this one for you. So you're seated in a chair, again, nice and straight and tall, and you come to the edge of your chair. With your arms out, you are going to stand up and sit down. And what you're doing here is you're purposefully trying to push your feet into the floor, trying not to move your feet inward, but to stand up and really use your trunk to stand up and not use the armrest or what have you. And again, you don't want to lean forward, you don't want to shift your hips side to side, and that's a great pose as well. These last two, I'm not going to demonstrate for you, but the first one on the left is the desk upward dog pose. You can see just what it is. So you start with your hands straight out on the desk, and then you're pushing up. And this stretches, again, your chest between your shoulders, and it stretches out your whole upper back. And then finally on the right, we see something called the forward fold. So this person is touching the floor, but you can just reach forward and just let gravity take over and reach down as far as you can. And by letting your arms and your head just hang there, you decompress. Now, you're probably saying, okay, you're crazy. Who has the time for this? But this takes a couple of minutes. Even if you do one pose, it really does make a difference in your stress level. So very, very simple yoga poses. Some other simple things that we can do related to total body wellness. Stress well, eat well. Love this. Again, you can read the slide. Purchase shelf-stable foods, etc. We do need to pay attention to portion sizes. Definitely stay hydrated, because oftentimes you feel quote unquote hungry, and it's not that you're really hungry. you're thirsty, you're dehydrated. So that's very important. The other thing is just in general, try to keep it healthy. So one thing we've done as a family since all of this has started, our local farmers market has reopened. We've been doing a lot of things to get, more healthy foods incorporated, because what you find is that if you're relying on the processed foods and such, I'm not saying they're bad, but if you're relying only on that, it weighs you down, and it makes you feel kind of sluggish. So certainly get a nice balance of your food. Along with that, move well. And again, I'm not going to tell you what to do or not do, but find something. Again, the other 23 and a half, I don't care what you call it, you have all of that time in your day. Take 30 to 60 minutes just for you. Maybe it's a walk, maybe it's a bicycle. Around our neighborhood, everybody has gotten bicycles, and my office faces the road, and I see people out on their bikes all day long. Try something new, maybe that is, engaging for you and your family. Do it as a group, do it with your kids. Again, just find something that works for you. Now this next section, don't laugh too hard at me. These are our resistance band exercises. So every one of us is in a community of some sort. Go down to your therapist and get some TheraBand from them. I would demonstrate these, but I'm a therapist and I have absolutely no TheraBand in my house, which is pretty laughable. So you're just gonna have to look at the slide to see them. I will tell you, when I do this session live, I actually do use my TheraBand, and you probably can't tell, but I am wearing a skirt for this session today. I can do these exercises in a skirt, in pants, and whatever, so there's no excuse not to get up and get moving. So the one on the left here, we call it a lunge with a biceps curl. So you can certainly see it. The person's starting with the TheraBand under their foot, and then they bend down to the ground. And while they're doing it, they do a biceps curl with the TheraBand. And again, 5 repetitions, 10, 20, whatever, and then switch sides. The one on the right-hand side on this slide is called the Hug the World plie. So taking a page out of ballet. So you can see the person standing there, and they have the TheraBand wrapped around their shoulders. And as they bend down or squat down, they bend in with the TheraBand. So obviously they're working their arms and their legs here before they return back to the start position. And again, repeat it 10, 20, whatever times. The next one is a squat with an overhead press. So you can see here the person has a TheraBand under both feet, and then it's shoulder height, and as they squat down, you push the TheraBand up. So again, you're really working out the arms. You could do this without squatting down too, and work it even harder. On the right-hand side, no, I would not do this one in a skirt, I will tell you. But this is called the crunch with a lat pull down. Would I even do this at work? Probably not, because I don't know that I would want to lay on the floor. But you can see what they're doing. They're laying there, and as they crunch up, working their abs, they're also moving their arms. So getting a little bit of a workout in there. And 2 more. The one on the left is a side lunge with a side raise. So again, you can see in figure A, the person starts in the lunge, and as they come up, they pull their TheraBand across their body. So you're working your trunk quite a bit. And then the one on the right is a side bend. So again, you can see them standing on the TheraBand, and then they're just leaning from side to side with their TheraBand. These are really easy. And again, things that you can do in just a couple of quick minutes. But to be honest with you, if you tried these, I will tell you, it will get your heart moving. And these bands are easily accessible. These are super easy things that you can do right on the job. If you don't feel like doing that, at a bare minimum, do some stretches. So, some shoulder rolls, stretching out your neck, doing some neck rotation, shoulder circles, even just, I love this. We do this in a matter of balance training quite a bit. If you're not going to do anything else, do the biggest yawn you possibly can. So if you guys do that right now, you can just feel yourself stretching out. So just a giant yawn. Even if you don't want to add resistance to it, just do some stretches. What it does is it keeps you limber, and it also helps, by the way, to prevent lifting injuries. And then you can do the same thing with your lower body, doing chair push-ups, or, pointing and flexing your toes, or even just standing up on your tiptoes and doing maybe some of those yoga poses even will help with lower body stretches. Get moving. I guess that's the message, right? Some other things we need to do, and I think a lot of these are pretty intuitive, but keep your immune system strong. Easy things, make sure you're getting enough sleep, and we'll talk about that in just a second. Eat well, stay hydrated, make sure you're taking your vitamins, you're getting your prescriptions filled. That's been a struggle for some, I know, because during this time, the pharmacies are not getting the medications necessarily that they've always had on hand. So make sure that you're staying up to date with that. Prioritize your own personal hygiene, wash your hands, cover your cough, things that you should be doing anyway. Stay home when you're sick, get fresh air, stay out, active, etc. So let's talk about sleep. And again, in the face of what we're doing right now, what we're seeing is that people are not getting the sleep that they need. We need at least 7 to 9 hours of sleep. And we're seeing people working much, much longer shifts, doing things that they wouldn't normally necessarily do. Some are working different shifts, and we're just not getting the sleep that we need. And that's a problem because it's going to lower our immunity. It may cause increased accidents, errors. We need that sleep to fight off infection. That's the best thing that we can do for ourselves. So how do we do that? Some things that you can do. When you wake up, get at least 15 to 60 minutes of bright light. Now, if you don't have good daylight, if you're getting up too early, maybe it's a light box, maybe it's just even a bright indoor light, or maybe when the sun does come out, you get outside. Instead of drinking your coffee at the kitchen table, you drink it outside or something. Exercising close to that wake time. I will tell you, just from a personal perspective, I've always exercised at night for whatever reason. And now that I've flip-flopped and doing it more so in the morning, it's a different story. And I don't know if anybody has felt that, but I feel like I'm just very energized and just ready to take on my day. And I'm finding that if I do exercise later on at night, it's interfering with my sleep. Taking naps, again, where I wish we all could take naps, but even if you could take a quick 10-minute, 15-minute nap, that recharges you. And certainly, I know the research always historically said we can't bank our sleep, but we can. And if you find that you're going to be working a longer shift, maybe try to get a little bit of extra sleep to make up for it. Use your caffeine, limiting alcohol. That makes perfect sense. Caffeine, love it to pieces. I drink coffee quite a bit. It helps, but then it brings you down. Keep a regular sleep and wake schedule. Creating a regular bedtime routine of quiet activities. Again, these are pretty intuitive things that we've been doing. Limit your alerting things, particularly things that offer blue light. So your television or your phone or even a computer. And I shared, give me 1 second, I should have them here somewhere. There we go. Forgive me. I just got glasses that are blue light filters, and they're wonderful. So when I find that if I have to work late at night or if I have to do something, using something to even filter out that light will certainly help your sleep. And then optimizing your sleep environment, make it quiet, make it comfortable, turn the screens off, etc. Okay, so connecting with others. I don't think I need to go into this. We've been talking about this quite a bit, but I have shared and I will continue to share. I think it is physical distancing, not social distancing. We need to get creative, as the person who chimed in the Q&A said, we need to get creative to get people back together. And I just read something the other day that they surveyed people, what's the first thing that you want to do when you get out of quarantine, or you bust out, as our person said. And they said, I want to see my friends and family. They don't want to go on a cruise. They don't want to go on vacation. They don't want to go out to eat. They don't want to go to the drive-in. They want to see friends and family. So where, again, and how we can make that happen for people, we want to do that. That'll certainly help with your stress. So make your social wellness checklist. Again, right now, this is where we get creative. Take a class, try something new, join an online group, even things that we can do with our families, Zoom things, what have you. Get creative. And take care of yourself. Ask for help. Make a list of ways that other people can help you. We would love to be Superman, Superwoman, but we're not. We need help, and figure out how we can divvy up that workload, right? And make that to-do list. Set your daily routine and take those breaks. we are not invulnerable to experiencing emotional distress during this outbreak. And again, it's compounded by the fact that we're caring for our families at home, we're caring for our residents at work, and it really does take a toll. So again, I'm going to say it again, find what works for you and keep up with it, but you have to make a commitment to do that. Also building healthy relationships. So we're going to talk a little bit more about some of these, but disagree respectfully. We shouldn't have conflict during this time, and I know we do, but let's try to mitigate that in our own families and in our workplace. Listen to other people without judgment, without blame. Open yourself up to seeing a different side and seeing a different opinion. Certainly share your feelings. Avoid being critical. We want to give feedback, but we want that feedback to be positive, and certainly working on compromise. Hope. This is probably one of my favorite things. Hope is that expectation that everything's going to work out and that everything is going to be okay. And think about it. Right now, people don't have that. They're discouraged. They're hopeless. They're angry. They're frustrated. So we got to figure out the ways to find hope. And you can certainly read the slide here, but maybe it's asking other people, how did you get through this? Or taking time to learn from history how maybe they survived pandemic and how they got through it. Certainly sharing those stories of hope. You know, somebody who's been through this crisis and has come out on the other end, or somebody who's really helped. You have to seek out those stories and certainly share them with others, because we don't have that right now. So again, look for the positive. What else? What else? We've talked about a lot of this, I think, but again, meet your basic needs. Please, please make sure you're doing that. Again, I don't know about you, but I find when I get really tied up in work or doing something, I skip lunch, I forget to eat, or I won't drink my water or something, and I feel it thereafter. And I think, you know, we probably all feel that at some point. So please make sure that we make that a priority, because if you are not well, you're compromising your own ability to take care of others. Certainly taking breaks, we've talked about this, but it's a walk, it's listening to music, maybe it's calling home, or who knows, it's engaging in prayer, whatever, again, works for you. Connect with your colleagues. We already talked about communicating constructively, and I think part of that is complimenting each other. Compliments are powerful motivators. They are powerful stress busters, if you will. So share your frustrations, share your solutions, and work on some problem solving with others, and certainly work together to figure out, again, what is going to work for you and for your community. We've talked about contacting families, and again, respecting differences. Some people need to talk. Other people just need to be left alone, and somewhere we have to meet everybody's needs. Although I would caution that person who just wants to be left alone, we don't want to leave them alone for too long, because we still do need to come together during this time period. It helps certainly to cope. What else? What else? Self-check-ins. Again, monitor yourself over time for any symptoms of depression, any symptoms of stress disorder. You'll probably laugh at this. I was home visiting my family last weekend, and I decided to do the PHQ-9 on my entire family, myself included. And I was a little surprised by the results of that each of us in our own way was showing signs or symptoms of depression. And I think we just need to be very honest with ourselves that we are not immune to that. And if you are feeling that, if you are seeing that, share it with someone. You don't have to do this alone. Whether you talk to a peer, a friend, a family member, a supervisor, even if it's a professional, don't go through it alone. Certainly honor your service. You know, remind yourself that there are obstacles, there are frustrations, but you are fulfilling a really noble role, whether it's taking care of your residents, taking care of your families, whatever it is, and recognize that and give yourself a pat on the back for doing so. Certainly setting boundaries, you know, particularly, again, I share this because I work from home. I have this tendency, I will work 24/7. My office is right across the hall from my bedroom, and it's so easy to get in there and do things. Whether you're on site, you're at home, you got to set those boundaries and find time for yourself. Distract and redirect. Again, it might be meditation, it might be yoga, it might be journaling, it might be art. figure it out and be very mindful of your time. This is something that I decided to do as I put this session together. And I found myself like, oh gosh, you're spending a lot of time doing this or doing that. Could that time be better spent? And that's me. I'm not saying anybody's spending their time poorly, but you'll figure out what works for you. When I really looked at how I was spending my time, I said, I don't like that I'm spending it doing this. I'd rather be doing something else. So again, be very mindful of what you are doing. Some staff responses, again, it's important to consider that the stress that we have as caregivers, what we're facing, is going to transfer over. It's going to transfer to our family, our friends, anybody we come in contact with, our residents. We're all dealing with that. So I've said this and I'm going to say it again, model the behavior that you want others to have. Share with them the messages about giving space. When their emotions are running high, when they're feeling very stressed, give yourself some space. Tell them that it's okay to do the same. Share that routine is incredibly helpful. And we want, for it's our residents, ourselves, you develop the routine that works for you. It's not somebody else's routine, it's obviously yours. Share education about abuse and resources. If you've heard me talk before, I've said this and I'll continue to say it. We are understanding that in other countries, the rates of domestic violence, of child abuse, and sadly of individuals dying by suicide have increased quite a bit during this pandemic. So be vigilant, be watchful for those signs and symptoms, those risk factors, and all of that would go hand in hand with that. Practice self-kindness. Again, go easy on yourself. We sometimes we beat ourselves up over so many things, and don't do it. There's no reason for it. I assure you, no one else is beating you up. You're probably much harder on yourself than anybody else is, but take care of yourself, and again, gain that insight because it's so critically important. And some final considerations, support that regulation. You think about how people deal with their stress. Some people, again, want to talk it all out. Some people are going to be very stoic and they handle it, and you have no idea that they've had stress. Years ago, somebody likened it to me, and it really hit home, likened it to a duck. You see the duck floating along the water, looks completely calm and serene, but under the water, those feet are paddling a mile a minute, and that's how some people manage their stress. So some people really do have a tough time. Again, model that calm behavior. Prioritize those relationships. We've talked about that. I don't need to go back about that. Explaining the why behind your decisions. You're probably having a lot of things that are changing in your own environment, in your own home. And I know, like for my kids, we just went shopping this past weekend and my daughter had to wear a mask and she didn't quite understand that. And I had to explain the why behind it. When you do that, it gives people a sense of control. Help everybody to understand what to expect to whatever extent possible. Again, you don't have all of the answers and certainly don't make it up, but what you can tell them, certainly do. And then again, reframe behaviors. Remember that people are not probably coming to work as their best self when they're stressed, when they're frustrated, when they're angry. And it's not a reflection of them as a person, it's a reflection of their stress. So work with them and exercise that patience to understand where they're coming from and have that empathy to try and understand what they're going through. I have one more slide, and I do see that we have some questions in the queue, so we'll go back to those. I close out by saying this. Remember that we as caregivers we are the best predictors of how our residents are doing. We're the best predictors of how we are doing, how our family are doing, our friends, everybody around us. They're watching us, they're listening to us, and they're watching to see what we do. When we show that we take care of ourselves, we are giving them that trust that we can take care of them, and we are giving them the tools. We are modeling the behavior that they can take care of themselves as well. And again, I'm seeing that just easily here at home as I've started to really pay attention to what I'm doing for my own self-care. I'm watching my entire family follow suit, and I didn't say anything, I didn't do anything, but I'm modeling that behavior, and people tend to just follow along. So what is that old adage? You have to take care of yourself if you're going to take care of others, and this is certainly true. So with that, I'm going to lean forward here and just open up my Q&A. So there's a question in queue, and I think this is a wonderful one. What surprised you most about being quarantined? And if anybody wants to chime in and even offer some ideas there. What surprised me most? I think what surprised me most is that honestly, I kind of liked it. I don't know if that's the right thing to say or not, but I travel for business. My husband travels for business. We are involved in multiple sports with our kids, multiple events. We are coaches. We are scout leaders. For me, what surprised me is that I liked it. And I said, you know what? I want this, my family time, this just taking back and doing less. I want that to be my new normal. And what's one thing you will make sure you do if we have a second surge? Would it be something on your social wellness checklist? Again, I would say yes. If we had a second surge, I think the thing that would really be super, super important to me is staying in contact with friends and loved ones. I felt like I just missed that. And my family, they're not Zoom savvy. They're not anything savvy, bless their hearts. But it was a real struggle to just really stay in contact with my family and to put aside their depression that they were sharing with me and just really try to reconnect. So I think that's super important. Another question. Oh, holy cow, this is a great one. What might you say to folks in senior living who say they don't have time to take for themselves, particularly given that residents and other staff members are dealing with the pandemic much more significantly than themselves? And I'm going to say this, and I don't mean it, but I'm going to say it. Shame on you. That's what I would say. I go back to my final slide. You can't take care of others unless you take care of yourself. And I know that's lip service, but I'm living it, and I practice what I preach. Taking time for yourself doesn't have to be an hour, 2 hours. It can be 30 minutes. It can be 30 minutes spread throughout the day. It can be 5 minutes here, 2 minutes there. I think when they say they don't have time to take for themselves, they probably do. They're just not cognizant of it. So I would probably work with them to say, yeah, you gotta have time somewhere. Come on, you have to. Let's look at this together and let's figure out what's gonna work for you. Because again, I think that's part of it. When you say take time for yourself, a lot of people think, oh, I have to exercise, or I have to do this, or I have to do that. You don't. It's whatever works for you, whatever is meaningful and purposeful. That's what it is. What works for me is not necessarily the same for you. That's a fabulous question. So I thank the person who asked that.
Kathleen, I've got another question for you, but I just want to comment on that. I think sometimes we just need permission. We need that somehow we feel it's wrong or it's selfish if I take time for me when there's so much other stuff that's more pressing and urgent, like the pandemic. So I so appreciate what you're saying, and that it's different for every individual.
Yeah,
So,
and I could not agree with you more. I could not agree with you more. People think that, oh gosh, I'm at work, I have to do this, I have to do that, and you don't. Take 5 minutes for you.
well, thanks for breaking it down that way. So here's another question that actually got emailed to us.
Oh, sure.
All right, we have a multidisciplinary staff that normally does home visits for assessments. With Pennsylvania moving to the green stage on Friday, we're looking to start resuming home visits. Some of our staff are vocalizing they won't be comfortable with doing that until a vaccine is available. Others are much more comfortable with the prospect. Any suggestions you could share on keeping both staff and patients calm and safe would be most appreciated. We are using a series of questions and PPE, masks, hand washing, sanitizer, and social distancing. We are only starting home visits with patients who are comfortable with having one.
Wow, what a question. And if anybody, again, wants to chime in and give some food for thought here, I think I would start, and again, this is just me. We're talking about the vaccine. I get that. But let's take COVID out of it. Let's take the pandemic out of it. Let's talk about the flu. There's a flu vaccine out there. And would you think, or would somebody say, well, I'm never going to work until the flu vaccine is there? We wouldn't say that. And I'm not saying it's the same by any stretch. But I don't know. Is the vaccine the right answer? Is it not the right answer? I really don't know that. But I think what's at play here is not the vaccine as much as this person doesn't feel safe. And so the person in that question says, well, we're using PPE, we're using questionnaires, we're doing this, this, and this. I think you have to go back and say to that person, what is your definition of safe? Because it's not my definition, it's their definition. And I feel like we're meeting the definition, but they don't. So what can I do to make you feel physically, emotionally safe? And I think that's where you go. And you just may have that person who says, just no matter what you do, I'm not going to do it. And that's their prerogative. And you'll certainly deal with that in your own way with your organization. But I think we need to figure out what their definition of safety is. And it may not truly be the vaccine. It could be something else that we're just not tapping into. I don't know if that helps. And I don't know if you have anything else.
No, I think that's great. And I think, you're tapping into the fear that has kind of been the uncertainty, the fear associated with this coronavirus that has felt uniquely ugly and mean. And it has been, truth be told. But I like what you say too. Again, it's really individualized. And while the organization as a whole has taken steps to have great protocols, it sounds like there need to be individualized conversations to help identify what does that person need to feel safe.
Yeah, and with that response, I'm taking a page out of trauma-informed care. And one of the things that we talk about in trauma-informed care is emotional and physical safety. And we think our environment is 100% safe, but if our resident doesn't feel like it's safe, then we've got to figure out what their definition is. So we're talking about the employee. We can go also on the side of the person to whom would be receiving this home visit. What do you consider safe, and what can we do to make you feel safe? What's your definition? And I think that's how you'll get to it. It's a fabulous question.
Yes, it is. I totally agree. And your presentation was powerful and really gave all of us, I think, some really bite-sized, meaningful nuggets to be able to apply to each of our situations. I mean, already Janet and I've been practicing a few yoga moves in our chairs. So thank you for the practical strategies and just that ability for us to all develop a self-awareness and to give ourselves permission to be able to take the self-care. So thank you, Kathleen, and we will be back in touch. And just a few slides for those of you who have hung to the end to let you know a few things coming up. So this is coming July 15. This is a COVID echo. We are really trying to reach out to long-term care nursing homes all across the country and really build upon the series that we did previously with Elevate, Rise Above the Chaos, and really trying to find those best practices that we would do. So stay tuned, keep going to our website to really learn more about our COVID-19 echo. We have a podcast that we will be launching in July as well. I have been doing some fantastic interviews with people that I believe are some of the best and brightest thought leaders out there, and kind of their thoughts about what we need to do to elevate elder care. Let's say the COVID-19, that virus has shone a light on some of the flaws in our system and things that we need to do and can do differently and better. And so we'll talk about those things on our podcast. Coming up, let's see what we've got. Follow us on Facebook. We've got a live social media platform on Facebook, LinkedIn, and Twitter. So make sure you visit our Facebook page and like our page, and you'll hear lots of different things. And of course, you can find us on our website, thegreenhouseproject.org. So thank you once again, everyone, for joining our webinar. Thank you, Dr. Weisberg, Kathleen. Really appreciated your comments and your presentation today.
Thank you for
So
hosting me. I appreciate it.
yes, and thank you to Select Rehab. We appreciate that sponsorship and that they were gracious to share their talent with us today. So thank you, everybody. Have a good rest of your week. Take care.
Bye.
Bye.